Palpitations. Does it always suggest or diagnose something serious or a serious underlying cardiac ailment? Probably no. Again, smartwatches, is continuous scrutiny of your pulse rate a good smart idea? Again, probably no, except a few exceptions. Hello, I'm Dr. Soumen from Apollo, Hyderabad. I'm a cardiologist and cardiac electrophysiologist. I've been practicing in Apollo for the last 3 years, and it's a pleasure to be among you. Now, palpitations is actually an uncomfortable or a disconcerting sensation of your own heartbeat. Most of the circumstances, that heartbeat or the rhythm is normal and we just feel it, in which case it is not really worrisome. In some situations, a minority of situations, that palpitations can be the symptom which actually suggests or is a pointer at an underlying disease. Now, what are those diseases? We'll talk later, but most of the circumstances, friends, palpitations can be actually normal. And it's just that you feeling your own heartbeat. Feeling your own heartbeat is not a normal thing, because heartbeat and breathing, these are two functions which happen subconsciously and we don't really feel them. When we start feeling them, that's when we start feeling uncomfortable, and that becomes a symptom. In modern day and age, as a cardiac electrophysiologist, I deal with a lot of cardiac arrhythmias, and most of the patients that I see in our outpatients with palpitations are actually normal. Many of them would have obesity, many of them have poor lifestyle, bad sleep practices, they are awake through the night, they have overwhelming work, they have target-based work, they have some social or professional issues, they may have interpersonal problems. All of them lead to a lot of chaos in their minds, and their life is completely off, and that leads to a continuous baseline worry or anxiety which they're not aware of. And as a result of which, they end up sometimes when their mind is occupied, when they're occupied with something, they don't feel those palpitations. But the moment they go to sleep, they're alone, they're lonely, they start feeling those palpitations, the heart rate has always been there, but just they have become more and more anxious and more worried about it. Once they start perceiving it, then they start worrying about that symptom and start worrying whether it's a symptom of an underlying cardiac ailment. Now, remember, all these patients are already anxious, and a further worry actually worsens the vicious cycle, and they end up visiting the clinic. So how to basically understand whether palpitation is actually a symptom of a disease, or it's just a pointer at an anxiety or something which is not correct in your lifestyle, and you can easily fix it. Well, there are a few things that you need to look at. Just look into yourself, see what kind of life you're dealing. Are you sleeping well? Are you happy? Are you in a good space with your interpersonal relationships? Is all well at your work? Are you able to meet your targets comfortably, and you are very comfortable at ease with your work? If not, then again you have a reason why you are probably anxious. Again, the obesity is a pandemic these days. Like we've seen an exceptional increase in obesity and overweight in recent times, and many of such patients have sleep apnea, which is obstructive sleep disordered breathing. Now, when they sleep, they go into snoring, and that causes significant hypoxia, drop of oxygen in their blood levels in the night, and that causes them to get up with a suffocating feeling, with pounding of the heart or palpitations. That again is something that can be easily managed with a good weight management, good proactive weight management, good diet, good proactive exercise. So don't allow your weight to go beyond a certain point, which is your reference. And if your obesity or sleep apnea is overwhelming and cannot be managed instantly with weight control, then use certain aids, breathing aids like CPAP or continuous positive airway pressure, which can help you get over this sleep apnea. So these are a few things that one can basically look into and understand whether the palpitation is really something that needs medical attention or not. On the other side, there are some diseases like cardiac arrhythmias, for example. There, the cause of palpitation is something which is much more serious. And patients who have anemia or thyroid related problems, these are issues or medical conditions which can cause palpitations, which is a more serious symptom and which needs medical attention. In these situations, your palpitations are rather episodic, or they are exertion related, and is often associated with a group of other symptoms. Like, for example, if somebody is anemic, they have serious exercise intolerance, they are fatigued, they are tired all the time, they don't feel proactive, they feel just lazy, they can't do anything if you are severely anemic. If you have thyroid problems, your palpitations are complicated with a lot of other problems like extreme weight loss, appetite issues, and there are day-to-day other symptoms which are associated with thyroid-related problems. Similarly, cardiac ailments. Now, palpitation is generally not the isolated symptom of cardiac ailments. You may have palpitations, but is often associated with other overwhelming symptoms like extreme shortness of breath, sometimes giddiness, sometimes loss of consciousness in serious issues, and again, exercise intolerance. So, I think the key point here is if your palpitations is associated with other symptoms like I just mentioned, and you have a medical background of cardiac illnesses or severe anemia or thyroid issues or similar conditions which can cause palpitations, then you probably need to see a physician. But if you have overweight, a lot of disturbance in your life, quality of life, including professional and personal problems, if you have a kind of a personality where you get really worried about trivial things, you start doubting your health, and you're constantly watching your heartbeats and monitoring, scrutinizing your pulse rate with following your numbers, then probably your palpitation is less serious, because that palpitation is just self-generated. Continuous palpitations, tracking your heart rate all the day, my friends, is just complicating the problem for yourself. You're creating a phantom problem for yourself. The problem is never really there. It's a minor lifestyle related problem and can be easily fixed at your level and needs to be done at your level. Thank you.